90% of the Indians, they have been scammed by fake celebrity endorsements.
Especially to today's Gen Z kids, because they are very obsessed and influenced by how they're looking on screen. So if they openly, transparently talk about all these things, it'll be like an empowerment. But then if they are, hiding certain things and...
What exactly is this plastic surgery, cosmetic surgery?
Now in plastic surgery, we generally deal about reconstruction, either in trauma or in onco-related cases. Like for example, if a patient undergoes any onco surgery, we might have to remove, the oncosurgeons generally remove a part of their body which is affected with cancer. Now we as plastic surgeons, we tend to reconstruct that part.
Beauty is not just about products and surgeries, it is also about
restoration mainly, yeah. And sometimes that restoration can be physical. I mean, we can restore a hand, a breast or a leg or any part of the body. But sometimes that same restoration is even emotional.
What are the challenges in this medical field?
A lot of male teachers think that it's a useless thing to train a woman.
Dr. V Kinnera Reddy, ma'am, welcome to the Honest Hour. Ma'am, like in India, most of the career choices are made based on family expectations.
Right.
You chose medicine or medical field as a career option.
Right.
Do you have a history in the family where there are doctors, or was it your own choice? Or was there some precipitating factor that made you choose MBBS?
Yeah, so I'm the only person who's a doctor in the family.
Oh.
And I mean, it was definitely not my choice, but probably I think the influence has come from my grandfather.
Achha.
Probably because there are no doctors in the family. He wanted me to be, I'm his first grandchild. So he wanted me to be a doctor. And right from the beginning, I mean, he always used to tell me stories related to, women empowerment.
Okay.
Yeah, so all those things. And he always wanted me to be a doctor. But then my dad never wanted me to be a doctor at all.
What was the reason for the same?
So when my dad was studying in the engineering college, he saw his counterparts always struggling with studying 24/7, not having a life a college student is supposed to have.
Yes.
Whereas these guys, the engineering counterparts, they would
they
always,
used to chill out.
They used to chill out and just, go right before the exam and just give the exam and come back. So he saw them personally. So after I finished my 10th standard, he literally took me to all the top doctors in Hyderabad, Nageshwar Reddy garu, and everyone, all the big shots of all the hospitals, and told them, please spend 5 minutes with my daughter. And when she comes out, she has to say that I am not going to take medicine. So that is how my dad wanted me to, have a very peaceful life. So he because he saw the struggles of his own friends closely. But then I think my grandfather had a bigger influence on me.
True.
It was literally engraved in my brain. So I did not even have a plan B. It is plan A was to become a doctor, plan B and plan Z was also doctor. That's it. Yeah.
So you stuck on to what you wanted and you had that clarity and conviction that I want to become a doctor no matter what.
Yes.
In spite of your dad putting in so much of efforts, they were all in vain.
Absolutely.
Yeah. Having chosen to take up MBBS, like any challenges that you could remember you and your family faced during your preparation phase or, once you got into this field? Yeah,
I mean, there is a lot of peer pressure, especially in the Indian families, South Indian families especially. They expect you to be the topper of the, in the MCET and all that, and they expect you to get it in the first attempt.
Right.
Sometimes it's difficult. Of course, I got it in the second attempt. But then, I mean, my family was very, very supportive.
Is also a bit taxing, right?
Yeah. So you cannot afford to go to all these parties and weddings, family functions and all that.
A lot of sacrifices.
Definitely. When you don't attend, they say she's not even coming. But when you attend, it's like, why is she coming? She's supposed to study.
Exactly. Yeah. It's a paradox.
Yeah. So relatives are always there to poke you. Yeah, that was always there. But I think now I just laugh about it.
Then once you got into MBBS, ma'am, you chose plastic surgery. Any specific reason that you chose this domain?
So I did my master's in general surgery first. So when I took up master's in general surgery, I had no idea that I'm going to become a plastic surgeon. So I think my chief then, she's a plastic surgeon, Dr. Thangam Varghese. She influenced me to be a plastic surgeon. Today, the reason I am a plastic surgeon is hands down Dr. Thangam Varghese. Like how I am a doctor because of my grandfather, I am a plastic surgeon because of my mentor.
Right.
Yeah.
Right. Because at that point of time, there were very few doctors taking up plastic surgery.
Right.
At least in the Telugu states.
Yeah, right.
You know, when it was plastic surgery, people had to go to Delhi or Bombay. Exactly.
Yeah,
you know, like most of the times.
Yeah.
But yeah.
Yeah. So plastic surgery is a branch which has a lot of taboo in the society. So when I took up plastic surgery, also all my relatives said, "Why did you take up plastic surgery? On whom are you going to operate? Because in India, nobody gets plastic surgery done. So what are you going to do?" I think they
like
looked
usually people think in Hollywood movies they get it done, or people in Western countries do it.
Yeah. So I think that taboo is still there in the society. They literally look at plastic surgeons like as if, you know, they're not doing any work. They're just going to sit idle in the hospital because they don't believe that we do have patients.
Right.
Yeah.
What was one craziest myth that you heard about plastic surgeons, man?
That we use plastic in plastic surgery. Yeah, that is the biggest myth.
Okay.
Literally last week also, I had this young boy studying, I think, 7th or 8th standard, and he had an injury to the knee, and they went to the ER and they told him that he will require a plastic surgeon to operate on him. And the next day morning, we operated on him. The first thing he asked me was, "Doctor, are you going to use any plastic for me?" So I said, "No, why did you get that doubt? Then why is the name plastic surgeon?" Then I had to explain to him that plastic surgery, the word has been derived from a Greek word called plastikos. It means to mold.
Achha.
So we mold the tissues in the way we want it to, you know, restore the damage that has been done. That's the reason we call it plastic surgery. So
taking a cue from his question, like for a common man, even that kid had the same doubt. Like, what exactly is this plastic surgery, cosmetic surgery?
Yeah.
Then more often we read about dermatology or skin doctor, not even dermatology. People say skin doctor there kelthunam. But what is this distinction? Like if you could explain it for a common man in a very brief manner.
So plastic, it is plastic, reconstructive and aesthetic surgery.
That is your specialization.
That's my specialization. Now in plastic surgery, we generally deal about reconstruction, either in trauma or in onco related cases. Like for example, if a patient undergoes any onco surgery, we might have to remove, the oncosurgeons generally remove a part of their body which is affected with cancer. Now we as plastic surgeons, we tend to reconstruct that part. Using the patient's own tissues elsewhere of the body parts. Now that is reconstruction. We also do it in case of trauma, in accidents or something. If they lose any part of the body, we reconstruct it back. Now that is reconstruction. We also do it in case of burns, when there are kerosene burns or flame burns and all that. We reconstruct the tissues. And there's again cosmetic surgery, wherein we try to enhance the patient's own features to make them look even more beautiful or confident. So that is cosmetic surgery.
So it's like beauty enhancement.
Exactly.
So it's done in a medical manner, or how does it actually work? Like
definitely,
is it through equipment, or is it through creams? How is it done, the cosmetic surgery?
So there are multiple things again. For now, we generally analyze, understand what the patient wants, and give them. We also analyze. Now that every patient usually comes with another picture of a celebrity or something, and then they say, "Can you make me look like that?"
Right.
Now
most of the patients.
So as a plastic surgeon, we sit and listen to all their demands, what exactly they want, because we need to understand the mindset of the patient.
Right.
And then we analyze the patient as to what is our analysis, what are the mistakes or the flaws that what are the flaws that the client has.
That can be done.
And then we try to match we give them a flow chart of things that these things can be done in you to make you look more, not just attractive, but if there are anything that we can make a minor corrections to improve their own unique features. And then if it's matching, or sometimes the patient's demand for something else, we try to explain to them that this is what is actually needed as per your face proportions. But then if they want something else, we sit and talk and analyze and do it. Sometimes it happens through non-surgical, like lasers or injectables and all that. And very rarely through topical application if it's just about some pigmentation related or something.
Because the reason for me asking this question is, like, nowadays we see a lot of boards like cosmetology, near beauty salons, parlors, even dental clinics.
Yeah.
So what exactly is this cosmetology and the difference between cosmetic surgery?
Yeah. So
There are people are putting like cosmetician,
right.
cosmetologist.
Right. So they are all, I think, they all come under quackery, if I should say, because the only cosmetic surgeon you can come across is a person who has finished their training in general surgery or at least 6 years of plastic surgery residency or 3 years of plastic surgery after finishing general surgery residency.
Achha.
So we take almost 15 years to get trained. Whereas there are some people who, unfortunately, they get trained for like a couple of days maybe and then call themselves as cosmetologists.
Just certifications, courses, and they call themselves as
Now, I think we should leave it to the
audience to understand.
Exactly. You have to analyze where you want to go. You cannot, just to go to a restaurant, we do so much of research, read the reviews and all that. Do you really want to be under the knife of a person who doesn't even know, who doesn't even have the proper degrees and proper experience to handle you? So I think we should leave to them.
And who cannot come to your rescue if something gets botched up. That is also...
That's when they come to the right doctor.
That's when after the damage they come to the doctor.
Exactly. That's when they research.
Sometimes it could be too late also.
So then we have to do the damage control.
And coming to dermatology, ma'am, is it linked to this? How does it work like?
So there is a mild overlap between the dermatologists and the plastic surgeons. They do injectables and some areas of dermatosurgery. And as plastic surgeons, we also deal with certain lasers and non-surgicals, injectables and all that. There's a mild overlap. Of course, that overlap is there between multiple departments. There is orthoplasty, so orthopedicians and plastic surgeons do it, oncoplasty,
cardioplasty.
So I think plastic surgeons are someone we enter into everybody's territory because we are linked everywhere. So that overlap is always there.
But as a subject, it's a separate domain.
So dermatologists deal, they deal with skin.
So that clarity, patients need to have whom to go for what purpose.
Exactly. That's what I always emphasize. Do your research first before you go to a doctor.
Right. Like you've done your fellowship in Spain. Right, regarding aesthetics.
Aesthetic surgery,
Aesthetic surgery. Any specific reason that you opted for Spain, number one? Secondly, what is the difference in the mindset or what is the difference in the patient mindset also and the procedures that they follow when it comes to aesthetic surgery compared to India?
So I think the volume is more the fact exactly so we see a lot of surgeries in 1 week. I mean it's in a span of 1 week we see like more than 100 surgeries there. I think that taboo is not there in the West. Like it is there in, especially in east part of the country. So I think the Westerners, the taboo is not there and they don't feel like it's a wrong thing to get a plastic surgery done.
But here sometimes they overdo also, right?
That is there. I think
is also there.
That is there. That abuse is always there in the West. But I think it's usually the volume is very good. And of course the techniques that they use and the technology is slightly far ahead compared to India. So I've done my fellowship there. But I'm glad I did because the exposure was very good. But today I think we are in par. Hyderabad is, I mean, people don't have to travel to other countries to get any kind of plastic surgery done. So just like me, there are many plastic surgeons who are trained abroad. After finishing the plastic surgery also, they have been trained abroad to perform the cosmetic surgeries. So equipment wise also, we are in par with the world, Hyderabad. So I think that need is no more there for people to travel abroad to get the plastic surgery done.
Any cherishable moment that you can recollect from your days in Spain?
Oh, wow. The best part about working in Spain is the work-life balance is very, very good there. I mean, if you cannot even talk about the work-life balance in India. I mean, that concept doesn't exist here.
People look at it as a taboo or something which is something is a wrong thing to do.
Even we don't feel, we somehow feel guilty to take an off also. But in Spain, that work-life balance is very good. So once you're done, I think you have a very long weekend weekend there. Friday afternoon, the weekend starts, and you can like really refresh yourself, and Monday morning you can get back to work. But here it's like Sunday night you're working, Monday morning you're working. There is no Sunday, there is no off, 24/7, 365 days. Doctors are always working in India. True. That work-life balance is something that is missing in India. Yeah, I think that will definitely, I feel that it will definitely impact on the results. Right. I mean, definitely the doctors will get stressed out, right? Burnt out somewhere. That will, to maybe after, it'll show up after a couple of years, now that we are slightly on a younger age group. Right. I think we are trying to pull it off. But then maybe once we hit maybe late 40s, it'll show up. Yeah, so I think it's very important to not get burnt out, right, and take some breaks at least. Yeah,
you're a woman in a highly demanding surgical field, ma'am. Like many young girls would be watching you.
Yeah, right.
They might also get some motivation or also get a direction. So can you tell us, people only portray the rosy picture.
Yeah.
What are the challenges in this medical field, starting from your medical college to pursuing career as a doctor? What are the challenges that you face?
Yeah, definitely. I mean, first of all, they think medicine is not for women. Or even if you're a doctor, you can only be a gynecologist. You cannot be any other surgeon.
That's a stereotype.
Yeah. So
and many times, when there's a male and a female, they think that
male is the doctor and the female is the nurse.
this paradox is also
I think almost all the female doctors face this at least once in their internship.
Okay.
So especially in the internship, because we are also a little vulnerable then, and we are just new to the field. We're just getting exposed to the world of medicine.
Right.
So the patients, even if we go for the rounds during our internship, they used to ask us, isn't the doctor coming to see us? So I mean, it's very embarrassing for us to tell them I am the doctor myself.
Right.
Yeah, so that I think almost all the females will face that in internship.
It still exists till date.
Even now, definitely. If you ask the young girls in the internship, definitely they'll tell you. Especially in the government hospital setups.
Yes. So that stereotype is still there.
Definitely. They
consider like women are only for nursing.
Yeah, that's what they think. But now, I think even at the level of professional, even after you finish your specialization, after super specialization also, you have to be like, twice as calm and, as your male counterparts for people to actually take you very competent. Okay, and at the same time, you have to be twice strong also. Right. Because otherwise they won't take you seriously. At the same time, they expect you to be compassionate again. So I think those challenges,
blend of a lot of things.
Yes, especially in the surgical fields, people think that when they see a female doctor, I think they have this question in their mind: will she be able to handle this? It's a complicated case.
Preconceived notion.
Yeah. So I did come across a couple of times, and I've always, I mean, if you're not confident in me, I'm okay to just you go to your male doctor. But I think
you would tell it bluntly on their face.
Yeah, definitely. Even if they're not confident, I don't even know.
What we need to do.
I want my patient to have 100% trust in me.
Trust and confidence.
Yeah, only then I can deliver the results that they are expecting, and I think definitely you should tell them honestly.
But it's a sad reality that even after so many years and awareness, people still have this gender stereotypes.
Right.
Any other challenges, ma'am, that...
training also. I think during the training also, I mean, it's very harsh, but a lot of them say, you're a female, you won't be able to do this case. Call the other guy. Like in general surgery, usually we are like the minority, the girls. We are like maybe just a couple of us, 3 or 4 of us. The rest of them are men.
Another aspect, getting into surgeon, like most of the girls, they might get into MBBS, but very few end up into surgery.
Right.
So what are the major challenges specifically to surgeonship?
Yeah, so when I took up general surgery, I did my master's in general surgery in Manipal. So after the counselling, when I came outside and I told them that I took up general surgery, people were actually shocked. And instead of congratulating me, everybody said, why did you take general surgery? I'm like, why not? They're like, it's for men, it's not for women.
Oh,
I'm
seriously?
Like, yeah. So it's like always that taboo is there for orthopedics or general surgery. There are very few female orthopedicians, female general surgeons doing such roles. So in the training also, if there's a difficult case scenario, in spite of us trying to prove to them multiple times that we are equally competent, still we'll have our senior surgeons showing that gender bias by saying, I don't think you'll be able to handle this case, hand it over to your male colleague. Yeah, so I think some of the men are, kind enough to come back and tell us, cheer us up and say, it's okay, come, let's do it together and stuff like that. There are some men. And of course, there are other men who take advantage of it also. So, and yeah, there are, some men who pass on dirty comments.
Lewd comments.
Yeah, so I think it depends upon how they grow up and all that,
For
right?
that matter, I heard even the, what you call seniors, apart from the seniors, even the professors, treat the women, surgeons or doctors, pass some lewd comments.
Definitely. All those, I think many of them have to face those challenges.
Yeah. Some of them really take it, it gets to their head, like that they have a significant emotional toll regarding that.
So if you see, after a couple of months of the surgical training, there'll be people who drop out also.
Many people.
You
they
spend,
also get into depression sometimes.
Exactly. You spend years. I've seen a couple of my juniors, whom, if not in my college, the other colleges also.
Right.
I mean, they would come and ask me, how did you even sustain it? Because the treatment that they have gone, it'll become such a traumatic experience for them that they drop out, and then they have to spend so many years again to get back on track. And definitely they'll not take up surgery again. They'll take up some of, physician branches. Yeah. So I think we should, men, especially teachers, they should inspire young women to take up more surgical branches.
True. And also they have to take up measures to build that confidence in them rather than debilitating it.
Yeah, really.
Let's be optimistic that things might change in the future.
I think it is, because now we are seeing there are more number of women surgeons, there are more number of female orthopedicians.
Yes.
So I think slowly we are seeing that change.
Yeah, ma'am. One of the report of IMA, which I've gone through, it says that 35% of the doctors feel unsafe, and predominantly women. And also very recently, I think about a year or so back, the Kolkata RG car case incident brought up this issue where the kind of plight that women doctors face in night duties. Right. Yeah. So what are the challenges that doctors face during night duties? Yeah,
especially in government hospitals. We don't have specific, duty doctor rooms for females separately. Forget duty doctor rooms. There are no clean bathrooms also.
Oh my God.
So sometimes we spend the nights just standing and
several hours.
For hours together. We stand only in the ER seeing the patient's emergency cases. And there are cases, nights when you just sleep in the ER just on the patient's bed, because there are no proper rooms allocated to the doctors.
Many a times it is not just the seniors or the batchmates, it is also the professors from which female doctors or surgeons face some kind of uneasy situations.
Yes, definitely.
So can you tell something about that, ma'am?
Yeah, so the first day when I got my seat, and then when I reported to my HOD, he asked me, I think he was a little disappointed that I was, a lady there.
Okay.
Because, they feel like we are actually just wasting the seats.
Right.
And have the impression that, if the
wasting
same seat,
seats.
They feel like these girls are anyways going
through merit, and they think you're wasting the seat.
Yeah, they feel like, these girls are anyways not going to practice in future. They just go get married and stay at home. So they feel like instead of this female, if some male student has got the seat, they'll probably, be practicing and made more justice to the seat. When I got the seat and when I went to report, my HOD got, disappointed, but he asked me one thing, are you married? I said no. Then he's like, are you having any plans of getting married? Then I said, I'm not sure, sir. He's like, cancel all the plans if you want to, because I'm not going to give you any marriage leave or sick leave or pregnancy leave or maternity leave and stuff like that.
Right on your face.
Yeah, right on my face. And, I was like shocked. I was not even welcomed into the department. It was like that. So I think not just me, a lot of women face this. A lot of male teachers think that it's a useless thing to train a woman. They would rather train a man.
That way,
yes,
even till this date.
Yes. So they think that women are not as competent as men. But I think definitely, time and again, a lot of female plastic surgeons, or not just plastic surgeons, female surgeons are actually proving them wrong.
Yes.
So because,
they've done some phenomenal contributions also.
Right. So even when we face those challenges, the typical Indian or South Indian, be it North Indian or South Indian, so the typical Indian families, if a female tells their parents that she's been facing these kind of harassments at work, generally they say, finish everything and just pack your bags and come back home.
Because many a times, like, we go to our parents for the support.
Yeah, right.
But they themselves are not acting as a supportive mechanism. This is a common thing most of the youngsters face. Yeah.
So you need to face those situations alone. You have to be bold. You have to be strong. And you have to face them all alone. And win all those battles and come back. And still that battle is not going to end only in your residency. That battle is going to be there on every single day, on your daily basis also. Sometimes, you feel exhausted that do I have to continue this battle throughout my life to prove that I'm competent enough as a male counterpart? Do you think about how to manage the patient, or do you sit and worry about how to prove yourself that you are a competent surgeon?
Constantly.
Now that battle that you face within yourselves and then trying to prove to the society that you're a competent surgeon, I think that is something that you're actually wasting that energy. If we are equally encouraged like the male counterparts, I think we can focus more on the treatment rather than trying to prove ourselves as a competent surgeon. I'm just hoping that this situation is going to change and improve in future.
Those are quite some impactful statements and words that you have made. And I'm sure like a lot of the young aspirants or, young people who want to get into this profession will certainly get a cue on what is the challenge that they need to face and what is a mindset. The right mindset is required. Whatever you told, I think that will sum up. Yeah.
Because I feel that women are as competent, as strong, emotionally very strong. They will be able to multitask, face the situations. When they get those instincts, they know what they're doing. They know how to, emotionally clock out and do what is supposed to be done at that right moment. Just that if you don't discourage them, I think we can move to larger heights in life.
True that. And what is the least that you expect from your male colleagues?
Respect. That's it. I think just respect should be fine. You don't even have to think that we are superior to you in terms of the subject or skill. But if you're trusting us, if you're respecting us, I think that is enough. We will prove the rest.
That certainly is a need of the hour. Moving on, ma'am, like you have taken up plastic surgery. So was there any situation in your clinic, like you had your night duty, right? Then you went into your own clinic or workspace without much of taking care of the way you look. Now the patient expects a plastic surgeon herself to look beautiful. Right. Did you face such situations like?
Definitely. Sometimes they there are situations where they compliment and say, I want to look like you, I want to be like you and stuff. Sometimes they tend to become a little more over judgmental and they say, I think you need this correction. Why don't you do this to yourself? I think this is not good on you. I think your nose should be corrected or your eyes should be like this and stuff like that. I just smile and say, definitely, I'm looking for a better plastic surgeon to operate.
Sometimes it's also like they expect you not to age. They expect you to look perfect all the time.
I know.
Or sometimes it's trust deficit, If the surgeon is not, like well dressed or, optimally dressed, they think that, okay, can I trust this person? Themselves are like that.
Definitely,
end up coming to the right surgeon?
Yeah. So this is not there in the other branches. Like you don't expect this in when you're seeing a kidney doctor or a heart doctor or anyone. But yeah, if you're seeing a dermatologist or a plastic surgeon, I think there are certain standards that or expectations from the clients that that we are supposed to prove to them. Yeah.
Now, what are the hidden costs of being a woman surgeon that society doesn't see, and how do you tackle those?
Yeah, see, I mean, like I told you, there are certain challenges during our training itself. There is no proper rooms or duty rooms for us and all that. The training itself is very difficult. And there is also bias during the training from our mentors also. But in today's world also, when we are practicing, we still see that even though we are trying to prove that we are competent enough, sometimes biologically we are still females. So we do get exhausted. And I think some people don't accept that we get exhausted.
Right.
So they don't normalize us taking breaks. Especially, when we go through pregnancy and we come back from maternity. When I came back from maternity, I have seen my own teachers saying, it's okay, don't give her, she won't be able to do it. She just came back from maternity. Okay. So in spite of them being doctors in the same medical field, still if they don't understand that, the biology the woman goes through during pregnancy and during lactation and still if the woman is coming back to the work, I think it's a very pitiful situation. Also, when even now, we have to have that work-life balance. Definitely, we'll be having that mom guilt.
Yeah.
When I'm operating, I think about what my daughter is doing.
Yes. This question, how do you manage work and kids? Family, they will push. They will ask you, sorry. Yeah. In families, they'll be asking you whenever you visit a function or something. Yeah. Or even in the doctor circle also. Yeah. But they don't ask the same question to the male counterpart.
Exactly. So when I went for fellowship, people looked at me saying that, are you still doing fellowship? So you're not taking care of, you're not done with studying, you're not taking care of your kid.
So subconsciously you're also
you
made
tend to feel guilty, like, am I doing a wrong thing? Am I supposed to?
My kids?
So that guilt will always be there. And if you overdo things, they say you don't care about the family.
Exactly.
If you underperform, they say you're not competent enough. So I feel like, no matter what you do, people will always point out at you.
True.
So I think how to find peace and what is the solution for all these, I think, is ignorance. Just ignorance is bliss. So you just have to ignore about the comments that society is putting on you and the peers and your relatives are putting on you. Just do your duty as much as you can. But I think you shouldn't over push yourself also, because you'll get burnt out. So whatever is possible in your own limits, you should be able to do it. But I think you should enjoy and doing it.
Right.
Yeah.
I mean, that's the right mindset which is required.
Yeah.
Ma'am, recently in the year 2025, McAfee released a report in which they quoted that 90% of the Indians, right, they have been scammed by fake celebrity endorsements like Shah Rukh Khan's ads, Alia Bhatt's ads, etc. And then got into taking up some procedures, right? So what is your kind of guidance that you'd like to give these kind of people?
Yeah, so when celebrities talk about their transformations, if they're transparent enough, then I think it is more like an empowerment that, people are actually talking openly about what they've undergone. See, when you see an actor or an actress on screen, it is not just the way they are looking naturally outside. It is a lot of treatments that they have done for themselves to, look so young and attractive. And it is, and it's not like every person, every celebrity or every actor and actress undergoes treatments. There are actors and actresses who never visited a doctor. There are. I am not denying that. But definitely there is a lot of work about the photographer, the lightings and the editing. There is so much work behind the camera, behind the scenes that is happening to make them look the way they look right now. But if they talk about the transformations and if they talk about all these things like the photography, the lighting and these things, especially to today's Gen Z kids. because they are very obsessed and influenced by how they're looking on screen.
Right.
So if they openly, transparently talk about all these things, it'll be like an empowerment.
Right.
But then if they are, hiding certain things, if they're giving only half of the facts of what it is right now.
Or concealed facts, maybe.
Yeah. So if they're just giving you the concealed facts, then it is like people
might be misleaded.
Exactly. Yes, they get misleaded, and it is like you're influencing the younger generation to unnecessarily go through those procedures. Sometimes it's not required.
Right.
Just because some actress has done it, that doesn't mean you have to do it.
Yeah. There's FOMO also.
Yeah. That FOMO will be there, especially in the Gen Z kids.
Yeah.
So I think if they talk openly, that's an empowering thing. But if they give you the concealed facts, then definitely it's like the other end of the sword. Yeah.
But another phenomena is most of the times the fake advertisements.
Right.
AI generated ads are there, fake
Right.
advertisements are there.
Yeah, paid
People
endorsements.
just see that and they go. They trust that, okay, so and so celebrity holds credibility, or so and so person is a person whom I look up to.
Right.
Now, he himself is endorsing it and they go.
Right.
But end up getting scammed big time.
Exactly, that is there. So I think it's about you need to be very vigilant, be very mindful about what is happening, do your research well, and then go
Look
for
at
it.
the credentials.
Yes.
Put in some effort from your end also.
And I think as plastic surgeons, we also have the responsibility to openly disclose all the facts that and tell
Awareness
them.
generation.
Definitely, we definitely have a role to play there.
Right, ma'am. So, could you give a simple framework? When should a person actually go to plastic surgeon, or when should they avoid going to? Because you must be seeing a lot of patients coming in.
Right.
Many a times you must have felt that, okay, they have come to me for no reason.
Right.
They do not require a plastic surgeon.
Right.
So what is the framework that you like to give?
Yeah. So if you are facing any kind of psychological disturbance because of the way you look, I think you need to first talk to your plastic surgeon, and we have to analyze that whether the patient really requires it or not. And sometimes we even give them counseling. It's like, when the patient just walks into your clinic, we don't just directly take them to the OR. Right. There are a lot of consultations we do before finalizing that the patient requires this kind of procedure. Right. So we sit with them, talk to them. Sometimes we send them to a psychiatrist. We analyze whether they're just doing this out of peer pressure or not. And if that surgery is going to impact your confidence, if it's going to give a positive impact on your lifestyle, definitely you can go for it. And if it's not harmful for you, and if it's indicated for you, you can go for it.
Okay.
But there are certain things that, you're just doing it because somebody on screen is doing it. And if you're, just badly influenced by it, then
sometimes just because of peer pressure.
I know.
A social stigma.
Exactly. In aesthetics, you need to have that restraint, and you need to have that courage to tell them no. When it is not indicated, a good plastic surgeon will always say a no. I think that should be the real restraint in a good plastic surgeon.
But let's say you say no. It's the income that you're losing out on, right? So many of the doctors also have to run their clinics or the household, etc. So how do you balance this dilemma?
See, when I say no, I know that the patient does not require it. Now, in spite of me knowing that the patient doesn't require it, if I'm still doing it just for the sake of, finances or something, later that patient is going to come back and sit on top of your head and take out all your piece for the next couple of weeks.
Right. And it also hampers your credibility.
Yeah. So I think, definitely the credibility, and that's going to create a bad impression on the entire fraternity of plastic surgeons. So I think we need to hold our dignity and have that courage and tell them that it's a no and they shouldn't be going. If somebody else is doing it, then let them do it. But I think you're conscious when you know that you're not supposed to do it, you should stop there. Yeah.
Another aspect, ma'am, like when it comes to aesthetics or plastic surgery, it's an expensive affair. Right. Many people they think okay, I'm going to a plastic surgeon. It's like half of my bank balance is gone. Something like this, just on a lighter note. So recently we see some advertisements saying discounts, festive discounts, 70% off, 50% off. So what exactly is this what is the pricing point or this discount phenomena? The same surgery which was XYZ amount at a certain point of time, now they're offering it for such a low cost. So are these genuine? So
Yeah, so let me be very honest with you. Plastic surgery is not expensive. That is just a myth.
Acha.
Yeah, that is one
many
of...
people think that it's quite expensive.
No, it's not at all expensive. It is exactly the same amount that is going to cost you for other surgeries like a heart surgery or a kidney surgery. In fact, they're much cheaper than
lesser.
that.
Okay.
Yeah, so it depends on, I mean, the base price is always same, but it depends on the ambience. If you're getting operated in a very luxury clinic or something, probably a couple of grands more. But otherwise, it is pretty much affordable to a middle class person also.
Okay.
This is actually the biggest myth of plastic surgery, that it's very expensive. That is one thing. Number two, if somebody is trying to lure you with discounts, I think you should just run away from that clinic, because this is about your health. You cannot go to a place which is giving you discounts. Now, it's not like you're buying some clothes on a discount and wearing it and throwing them. Now, if you're going under the knife of a surgeon, that is going to stay with you for the rest of your life. So you cannot bargain, nor can you go for a discounted price there.
Right.
I think you should see the credibility of the surgeon, how genuine they are. And you should see how skillful they are, what are their before afters, what are their results, how safety is the place. See, all those things matter, not the price. Definitely not the price.
Based on your experience, ma'am, you must have interacted with several patients, okay? And also in your fraternity, plastic surgeon fraternity, is there any specific regret that you've seen from a patient, like after a surgery? So surgery is something that the patient has consciously taken a decision to take up.
Right.
But that same patient, after the surgery, he must have taken, he or she must have had a big regret. So anything of that sort?
Yeah, so I've had this very strange experience. A woman came to us asking for breast implants.
Okay.
And she already has a breast implant, which was done by another plastic surgeon. And she came to us for a bigger implant. And we further enhancement. So when we asked her what was the reason that she wanted, is she not happy with the size of the breast that she has right now? The reason she gave was, apparently her husband is having multiple affairs with some other woman. And she wanted a bigger breast implant so that she can catch a hold of her husband. We tried telling her that it is impossible, that she's not going to hold the husband back just with a bigger size of a breast. And she did not listen to us. She insisted that she wanted a bigger size of implant. We tried telling her, we took consent from her, we told her that it's going to be very painful for her, we are not supposed to do. We did our best, and she did not listen to us. The same patient got operated by another plastic surgeon. Okay, see, when you say, like I told you, when you know your conscious will tell you you're not supposed to do this, that is not the indication for her. You have to tell her a no.
Yes.
So the same patient got the breast implant done by another plastic surgeon. I don't want to name who it is, but so after doing that surgery, within almost 10 days or 15 days, she started experiencing extremely bad neck pain and shoulder pains, because she was not able to bear the size of the implant, because as per her height, as per her weight, as per her structure, she's not supposed to have those kind of bigger breast implants. But because she did not listen to the doctor's advice, she went probably, I mean, even though you don't do it, somebody else is going to do it in the market. And she got it done. She came back to us to get it removed again. So I feel like I always quote this example to women who ask for a bigger size, even though they don't want it. See, the reason why you want to get a plastic surgery has to be very strong. Now, if it's a genuine indication, you can get it done. If it's for some silly things like this, you are going to regret.
True that.
Yeah. So after she underwent all this, she understood that she made a wrong decision, and she came back to us asking for removal of that implant. So I think, but she,
at least she realized it later.
Yeah, but she had to pay a heavy price for it, right? She had to undergo multiple surgeries. She did not listen to when we told her first. Yeah, it's very traumatic,
right? It's an emotional toll as well. Yeah.
And financially,
physical and emotional.
Yeah, and how many times she has to undergo anesthesia and the aftercare, the downtime, the recovery period, the scars years are going to become tougher and tougher. So you have to pay a heavy price. Yeah.
So many a times, like people don't listen.
Yeah.
Though we give them advice in the right stride, they don't tend to listen. So,
but still, if you're strong in your decision, you will, when people come back and say, when they're not happy with the results, you can be very firm and say, that's what I told you.
Right.
Yeah.
Right.
So I think that's why when you know that you are making a decision and that decision is right, you have to be very strong and bold and tell them that this is my decision. It's up to you. If you want to do it, do it. Otherwise, you won't go to the surgeon who does it.
Right. Right. So, like, based on what you're telling, being a plastic surgeon not only involves doing the surgeries and the medical aspects, it also involves you to be a psychologist person.
Definitely.
An honest psychologist.
Definitely. We are half psychologists and psychiatrists.
Based on the cases that you've told until now, many times you're also counseling them. And honest counseling is what you're doing.
Nowadays, that has become too much with the Gen Z kids becoming our clients. I feel like I'm spending more time counseling the kids.
True that.
Than operating.
Yes, ma'am, quite interesting. So based on the discussion that you have told, beauty is not just about products and surgeries, it is also about the
restoration mainly. And sometimes that restoration can be, physical. I mean, we can restore a hand, a breast, or a leg, or any part of the body. But sometimes that same restoration is even emotional. It's about restoring the confidence that is lost after a trauma, after an accident. So that restoration is also important.
So you take care of that aspect as well.
Definitely. You have to,
Quite interesting. I didn't know about this dimension. Yeah, ma'am. Like for a young aspirant wanting to enter into MBBS or take up plastic surgeonship, what is the guidance that you'd like to give them, ma'am?
Yeah, so I think you have to be very passionate in what you're doing because plastic surgery involves a lot of precision. Okay. Definitely there's a lot of hard work in it, the years of training involved in becoming a plastic surgeon. But you need to be very, very patient because we put in hours of our time for operating. Sometimes we operate for almost 12 hours. 16 hours. Yes, the longest I've operated was almost 22 hours, I think. We were
22 hours.
Yes. So we reconstruct limbs, the entire limbs that are cut and brought to us in plastic.
So it comes in the prosthetics or?
Under reconstruction.
Okay.
Yeah. So we reconstruct the whole limb, which is just brought in a plastic cover. So it takes like so many hours and you have to be so focused. So it requires a lot of patience. So it's not as fancy as it looks like on the Instagram or TikTok to be a plastic surgeon.
Right.
So it requires a lot of patience. You have to put in a lot of hard work. Have to have a lot of focus when you're doing that. Perseverance should be there. If that is there, and if you have the passion for being, otherwise it's a very fantastic branch. It's it's very artistic. It's very fascinating because you reconstruct so many things from head to toe.
Right.
So it's very fascinating branch. But I think it's a very, very interesting branch. I think more kids...
You need to be very passionate about it.
Yes. So I think more people should take up plastic surgery. They will really enjoy it.
Thank you so much for those wonderful, insightful conversation, ma'am. A lot of myths that were there, you actually try to give the real dimensions for that, which we didn't explore earlier. And thank you so much for that. Definitely this conversation will have an impact on the youngsters of today. Thank you.
Thank you, Shashank, for having me here. Thank you.